The key deliberations in the symposium were premised around 5 thematic axes, which included community action in governance and accountability for health system strengthening, improving access to quality health services for the indigenous, excluded, vulnerable communities and those in fragile context, moving forward the agenda for sexual and reproductive health rights, setting the framework and agenda for people-centered accountability of private and corporate healthcare sectors, and forging alliances between the community and the healthcare workers. The thematic sessions were designed with the key purpose of field building and facilitating critical discussions. Each theme had 3 sessions, one on each day of the symposium, designed around varied practices of accountability drawn from Global South.
The health worker is there accountable the power in the system, and the communities are here struggling also, even though they are told that they have the power, but it's completely shallow and absent. And I think that's the role that the COPASA will play.
Community awareness on HIV and SRH services through drama, where we could go in schools, because we know that the girl today will be the next generation's woman, and these women will be vulnerable to HIV, and also they need to know about their rights to SRHR. Down there we are seeing people sleeping on the floor. This is when we petition government when our rights are not being fulfilled. We hand in petitions, and several times we are seen on the streets, and some of us have been arrested several times in Zambia.
I'm just struck by how much diverse experience there is, and we just don't have enough documentation of this. And not just documentation in the sense of we did this and then we did this, or we did a community scorecard and then we did, as you were saying, a report card and then we did some other things in some sort of sequence, but to analyze the trajectory of what you've done and the choices not made. So why did you decide to do a citizen report card and not a scorecard at a particular point in time? And what effect did this have on your work? So just documented in some more sort of deeper documentation of the experiences would be really useful, I think, for the community as a whole to learn.
A lot of our primary healthcare centres only have health workers that are in that centre. They don't have doctors, they don't have nurses, and if a doctor turns up, he turns up for 2 hours to see